Thank you.
Thank you so much for the donations. And I understand maybe there are about 1,000 of them, aren't it? Yeah. They are supposed to be 1,000, of course, we have to count. Yeah, but
Yes, it's 1,000.
yeah.
So I don't know Welcome our council officials and managers to this event, and also to welcome our friends and partners from SolidarMed, as represented by Mr. Chigaba and by Dr. Nzekwenika. So welcome to this event where SolidarMed is complementing the local authorities' efforts in our health delivery system, and we have been partners for a very long time. We also house them here as they also do several programs in the whole province, and then we also expect that that relationship continues to grow from one level to the other. Otherwise, welcome to the city of Masvingo as well, and they also enjoy the hospitality. Thank you very much.
My name is Witness Chigaba. I'm the SolidarMed Support Unit Manager. SolidarMed Support Unit is actually the administrative arm where we have the finance, the general administration, the finance and accounting. SolidarMed is a Swiss headquartered private voluntary organization. So it's both an international organization as well as a locally registered PVO. PVO meaning private voluntary organization. We are registered under the Ministry of Labor and Social Welfare, but our general operations are actually under the Ministry of Health and Child Care. We have 4 main projects that are namely Smart B, which is the HIV and TB project, which is also responsible for the STIs for which these drugs have been donated. SolidarMed has made a donation to the City Council. The drug is called Cifraxone. It's actually for the treatment of STIs. It costs about $1 each, and we managed to buy 1,000 of them.
STIs have a profound impact on sexual and reproductive health, and they can have serious consequences beyond the immediate impact of the infection itself. For example, we've got STIs like herpes, gonorrhea, syphilis, which predispose people to HIV. We also have these STIs causing stillbirths, neonatal death, low birth weight, and prematurity, among other effects, just to mention a few. Unfortunately, in Masvingo, we constantly advocate for the use of condoms as a way to prevent STIs and HIV. Unfortunately, the uptake and the correct and consistent use of condoms is very low, and this ends up causing a lot of infection through sexual transmission. So we eventually have to end up resorting to treatment of cases that have STIs. So for treatment, we use syndromic approach to treat STIs. That is, we aim to treat chlamydia, gonorrhea, trichomoniasis at one time using 3 types of antibiotics, as we do not have a lab at hand to detect which bacteria will be causing the STI. So syndromic management is the one that is recommended by the Ministry of Health and Child Care at clinic levels. Ceftriaxone is one of the important antibiotics in the management of STIs. Unfortunately, it has been out of stock where we get our medicines at the NATFEM since the 4th quarter of 2021. Therefore, currently, patients have been asked to be buying from private pharmacies, and key populations that we serve on a daily basis at times do not actually go and buy those antibiotics that we would have asked them to buy. And however, they continue doing their usual sex work and things like that, and which has contributed to the continual spread of the STIs. If we look at our statistics, since November 21, we have had a steady increase of the STIs. In November 2021, we had 159 cases. December 2021, we had 132. January 2022, we had 136, and the increase has steadily increased since January. February, we have had 183, March 194, and recently in April we had 190. So you can see that there is a steady increase because of the lack of the medicines that we are getting donated to by SolidarMed. It is against the statistics that we noted that we have a problem and made an action to source our medicines for the community to reduce the cases of STI, since it is an infectious disease. We approached many NGOs to assist, and thus we are very thankful that today one of them has come to bail us out and has managed to donate for us all the medicines that we are receiving today.